Dr. McDonald, thanks for talking with us. BC has just announced its highest number of infections yet. What recommendations do you have for Indigenous communities?
The same recommendations we've been giving all along. While we've seen the numbers in BC as a whole rise exponentially, actually things in First Nations communities have gotten better. We had a bit of a spike with community clusters in mid-September, but right now we only have one community cluster and only 6 active cases on reserve in the province. We have a larger proportion of people off reserve who we are concerned about, of course, but where there are fewer resources is where we're most concerned, and communities have done an amazing job at taking care of themselves and each other.
Are there any challenges you face in getting testing done in those more remote communities?
There are, but they're getting better. We work really hard with our regional health authority partners, and right now we have about a 24-hour turnaround to have a test taken to get a result back. The challenges, of course, are things that we're just getting into with winter weather and travel. Some of our more remote communities, getting the testing swabs out of the community to a testing center is a little more challenging. But we have been given the opportunity to facilitate and implement some testing machines through our partners in the federal government, and we're hoping that those will really assist us in making accessible testing closer to home.
Are there any new tactics from the First Nations Health Authority that are going to be deployed in the fight against COVID-19?
One of our biggest concerns right now is young people and COVID fatigue. We know that it's going to be particularly challenging getting into the winter, less likely for people to socialize outdoors, and recent decisions by our provincial health officer has meant that there should be less visiting in homes, but we know that's going to be really challenging. So we really want to target our younger folk to help them understand their responsibility to take care of themselves and everybody else.
Doctor, we'll have to leave it there, but really appreciate you taking some time for us here today.